Hello, and welcome to the pre-op education video for bariatric surgery. This is an overview of what to expect for your upcoming surgery at Reston Hospital Center. My name is Teresa Hiley. I am the bariatric program coordinator and nurse leader in the hospital. My role is to work closely with your surgeon, nurses, and especially you. We will work together as a team to deliver excellent care during your hospital stay. Please email or call if you have any questions after viewing this video. You're in safe hands. We have well-trained and understanding staff throughout the hospital. Our bariatric program is accredited as a comprehensive center by the Metabolic and Bariatric Surgery Accreditation Improvement Program, or MBSA QIP. This regulatory body sets the national standards that we follow to provide quality care. The Reston Hospital Center is a large campus. You may already be familiar with Pavilion 1-2 entrance if your doctor's office is here. It is indicated on the map with the yellow star, and this entrance opens at 5:45 a.m. Another important entrance to know is the West Wing. This is the closest entrance to the inpatient surgical unit. It is located at the bottom center of this map. If you stay overnight, anyone who comes to visit you or pick you up when you're discharged can park in Garage A, and the elevators are straight ahead when they come in the doors. This entrance is open from 6 a.m. to 8 p.m. Before your surgery, you have a pre-admission testing appointment. A nurse will review your medical and surgical history and current medications, including over-the-counter medicines and supplements. They will review additional instructions to help you prepare for your surgery, such as what medications to take or not take the day of surgery. This will be based on guidelines from the anesthesia provider. If you need blood work drawn or an EKG, they can take care of that there. This helps everything go more smoothly on the day of your surgery. After you pick up your prescriptions, please verify them with a medication reconciliation form from Dr. Green's office to verify that you have everything. The last thing you want is to realize that you're missing something when you need it, or that you have to make an additional stop on your way home after surgery. You may be asked for your ID or insurance card during the registration process. Bring any adaptive equipment you might need, such as your glasses or hearing aids, anything that you really need to get by. If you use a CPAP machine for sleep apnea, please bring your machine with you, the mask with the hose and the power cord. If you're not able to bring the machine, please bring your mask with the tubing and know your settings. A respiratory therapist will be able to help get you set up. We recommend loose-fitting clothing for going home. You don't want anything tight or constrictive that will irritate your incisions or your abdomen after surgery. These items are only suggestions to make your stay more comfortable. We have all the necessities, but you may want one of your favorite items with you. A longer charging cable for your phone will help you keep in touch with your family and friends. Space is quite limited in the small pre-op lockers. It is best if your larger comfort items, such as a pillow or a blanket, are brought in by your family member or friend when you are admitted to the surgical unit. The day of surgery can be very busy and overwhelming. Follow all the instructions you've received from your doctor's office and the pre-admissions nurse. Valet parking is available at Pavilion 1-2 entrance from 6:30 a.m. to 7 p.m. Valet parking is free, but make sure you get that ticket validated. When it's time, you're going to be taken back to the pre-op holding area. The nurse will have you change into a hospital gown, you'll get your IV started, and they're going to review a lot of the paperwork. You'll meet an anesthesiologist, and they will discuss with you the anesthesia care that you'll be provided. You'll meet your operating room nurse, and you'll definitely see your surgeon so you can ask any last-minute questions you've come up with. You can have a family member or friend stay with you while you wait in this area. Anyone who's waiting during your surgery can stay in the Pavilion 1-2 waiting area. There's a coffee shop nearby, free Wi-Fi, cafeteria, and a patient tracking monitor. The time in the operating room really varies from procedure to procedure, so your surgeon will be able to give the best estimate for you. When surgery is complete, you'll be taken to the recovery room. We call it the PACU, which is short for Post-anesthesia Care Unit. Unfortunately, visitors are not permitted in the PACU. If you use a CPAP machine, it may be put on you while you're waking up. The nurses will have you rate your pain on a scale from 0 to 10. 0 means no pain, whereas 10 is the worst possible pain. If you need, pain medication will be available. Once you've recovered enough or woken up, it usually takes about an hour or two. You'll be moved to 4 West, which is our surgical unit, or if you're going home the same day, to our secondary recovery unit. All the rooms on the 4th floor are private rooms. Each room has a recliner, a TV, and a whiteboard that the nurses will use for communication and to help track your plan of care. Our current visitor policy allows 2 adult visitors between 8 a.m. and 8 p.m. But we ask that anyone experiencing flu or cold-like symptoms or any other illness refrain from visiting. When you arrive to the floor, it is expected that you're going to walk from your stretcher in the hallway into the room. This walking will help begin to reduce the gas pain that you may be experiencing. It is extremely important to start moving sooner than later for your recovery. Your nurse will come in to help admit you to the unit and assess how you're doing. The patient care technicians will come in, take your vital signs, and you'll be hooked up to a telemetry and a pulse oximeter overnight. That way we can watch your heart rate and rhythm and keep an extra close eye on you. Our staff wear different color scrubs so you can easily identify what roles they fill. The navy blue scrubs are worn by nurses and the green scrubs by patient care technicians. The nurse leaders on the floor, like myself, will wear white lab coats. There are 2 ways to let the staff know you need assistance. There'll be a phone and a call bell in the room. The nurses and techs will leave their phone numbers on that whiteboard to communicate how to reach them if that's your preferred choice. I want to forewarn you that blood work may be drawn as early as 4 a.m. Sometimes I've even seen 3. But this is so that the results are available for the doctor when they come in, and they may come in as early as 6:30 or 7. Let's talk about pain management. We have a lot of different measures to help you be as comfortable as possible. Tylenol will be brought to you on a routine schedule every 8 hours to help minimize the discomfort you're having. Ice packs may help some people reduce the pain in their abdomen, whereas some people prefer warm packs for the gas pain that you might experience in your chest, back, or shoulders. Walking, I'm going to talk a little bit more about that further on in the presentation. Walking and movement is one of the best ways to reduce gas pain. If your pain continues to be elevated, there is pain medication available. Typically, it's roxicodone, and that can be taken by mouth and given every 6 hours as needed. This medication is ordered by your doctor as needed, so that's not going to be brought to you automatically on a schedule, but you will need to notify your nurse when you need that. I encourage you to ask questions, understand what medications are ordered and what you can have available to you. We're happy to answer those questions. Walk, walk, walk. Walking is the key to recovery from surgery. I cannot stress the importance of walking enough. It's the number way to relieve gas pain, decrease the chances of you developing blood clots, and help you take deeper breaths while you're upright. We encourage you to walk a minimum of 4 times a day, but I'm going to go even further than that. I recommend changing positions every hour. Just getting up, moving around, the frequency is much more important than the actual distance that you move. You will have sequential compression stockings on your legs during surgery and the first night while you're sleeping in bed. This is going to also help prevent blood clots while you're not up and moving. The incentive spirometer is physical therapy for your lungs. Use the incentive spirometer 10 times every hour while you're awake. When you take slow, deep breaths, you're going to raise the green level in the center. That's going to give us a measurement to how well or how deep your breath is. And the more you use it, the better you're going to get at this. You can set a timer to help remind you use this, or if your TV is on, every time a commercial comes on, take 2 to 3 deep breaths with the incentive spirometer, and this will help keep you on track. This incentive spirometer helps decrease the risk of you having respiratory complications after surgery. And if you wear a CPAP machine, we're going to want you to wear that whenever you're sleeping. If you're staying in the hospital overnight, we are going to go slow with your sipping. Your diet ordered is going to be called NPO, which means nothing by mouth, with a few exceptions. We're going to allow you to have sips of water, ice chips, and medications that you take by mouth, but we do not want you to have more than 2 ounces per hour. We'll have you drinking slowly from 1 ounce cups. There should be 5 to 10 sips per 1 ounce cup. We want you to go slowly, so no gulping. We want you to save the finished 1 ounce cups when you're finished drinking from it in the gray bin and use a new cup for your next ounce to sip. That way the staff can see exactly how much you're drinking and chart that into the computer for your surgeon. This is a reminder that after surgery you cannot have straws, carbonated drinks, lozenges, or gum. Those items all add extra air to your stomach and are going to make you uncomfortable. So we're going to not use that for a while. The morning after surgery, your surgeon would like you up in your recliner by 6 a.m. Beds are only for sleeping, so during the daylight hours, we're going to be up in the chair. You're going to start the Gatorade, sipping 1 ounce over 15 minutes from those 1 ounce cups. And if you're able to do 1 ounce slowly over 15 minutes, that will equal 4 ounces per hour. Now I only want you to sip the Gatorade starting at 6 a.m. until you've had your upper GI swallow study done. The upper GI swallow study will be where they take you down to radiology. You're going to be standing in front of an x-ray machine and they're going to have you sip small amounts of contrast so they can take x-rays just to see how your beautiful new stomach looks, make sure there's no constrictures and there's no leaks. It's just an extra safety precaution. Once you're cleared from the study, then when you come back to the room, you can start your protein shake and maybe taste some of those other liquids that are brought in on your tray, such as chicken broth. There'll be a water bottle with some Crystal Light to give you a different flavor. But really, the Gatorade and the protein shake should be your top priority. Sip, sip, sip. That is a new focus for you during this recovery phase. The goal for discharge is that you're able to drink 5 to 6 ounces an hour for a few hours, at least 3 hours. This will show us that you are able to keep yourself hydrated when you go home. At home, you'll need to continue sipping 4 to 6 ounces an hour to reach your daily goal of 64 ounces. Recovery after bariatric surgery is a full-time job. If you're able to sip 4 ounces an hour, that is 16 hours of sipping to reach your daily goal of 64 ounces. At 6 ounces an hour, it will cut that down to 11 hours of sipping. You can see what kind of a difference your day will be depending on how much you're able to sip per hour. The real goal is 6 ounces an hour, but that is also the maximum that we want you to drink per hour. That's why on the fluid log, I only have 6 columns for 6 ounces. Using a daily fluid log will help you keep track of how many ounces you're drinking per hour. Some patients have the option to sleep in their own bed on the night of surgery. The process is a little more condensed than what I described previously. You really need someone present with you in the secondary recovery area that will help you sip. The hardest thing is staying awake to sip and meet the criteria, but the payoff is a good night's rest in your own bed. It takes usually 4 to 6 hours in the secondary recovery area to meet those goals. The criteria for you to be able to go home same day is that your vital signs are stable and we've managed your pain to a comfortable level. You're able to urinate and that urine is clear or pale yellow. If you need, we'll give you extra IV fluids to help get you to a better hydration status. For sipping, we need you to be able to sip 1 ounce an hour over 15 minutes to get 4 ounces an hour. And that's for a minimum of 3 hours. So we're looking at 12 ounces. We need you up and walking every hour so that we can know you're stable when you're walking and show you how much walking really is important to this process. Whether you're going home the same day or overnight, we will not rush you out before you're ready. We're here for you to help you through this stage of your recovery. I want to touch on just a few of the discharge instructions. You will receive a discharge packet while you're here, and there'll be a little quiz to take, but don't worry, nobody ever fails. Discharge instructions will include dietary instructions, signs and symptoms that need to be reported to your doctor, pain management, activity restrictions, caring for your incisions, your follow-up appointments, and support group information. This is a list of signs and symptoms that we would like you to report to your surgeon or seek emergency medical assistance if it's an emergency situation. This list is not inclusive. If you have concerns, please call your surgeon's office. But if your heart rate is very fast, beating more than 120 beats per minute while you're at rest, if your temperature is greater than 101, uncontrolled nausea, vomiting, or diarrhea, and uncontrolled severe abdominal pain that is not being managed by you taking the pain medications prescribed, those are all definite reasons I want you to call your doctor's office. Shortness of breath or chest pain, depending on the situation and whatever other things are going on, could be a time where you want to go to the emergency room or call 911. I want you to keep an eye on your incisions, and if you see any redness, tenderness, or drainage at the incision sites, also let your surgeon know. Dehydration is the #1 reason for bariatric surgery patients to get readmitted to the hospital. If you're unable to sip at least 40 ounces of liquids per day, please reach out to your doctor's office. Dehydration will make you feel miserable. Checking the color of your urine is a good way to assess your hydration status. Your urine should be pale yellow or clear. If it's darker, if it looks more like apple juice, then you need to be either drinking more fluids or notifying your surgeon. Other signs that you might be dehydrated are sudden lightheadedness or dizziness, headaches, infrequent urination, a really dry mouth, rapid heartbeat, muscle cramps, or nausea. When caught early, it's easy to rehydrate you with IV fluids quickly. You will have either 5 or 6 small incisions on your abdomen after surgery. These incisions will be closed with a product called Dermabond, in other words, skin glue. We want to let it do its thing. It will start to dry up and flake off in 5 to 10 days. You can shower on day 2 after surgery. We just don't want you to scrub the incisions. Let the water just run down your abdomen. Soap is fine running over the incisions. We just don't want you to scrub them. After you get out of the shower, just pat your abdomen dry with a towel. Don't rub it really hard. Don't use any lotions or creams on the Dermabond that may make it fade away sooner. Also, we don't want you in any bodies of water. No bathtubs, swimming, whirlpools for 30 days. We want to let those incisions close completely. The Staples Club is our bariatric surgery support group at Reston Hospital. There's so many benefits that you can gain by attending a support group meeting. We welcome and encourage anyone working through their pre-op phase to attend. Come, ask questions. We have 2 different meetings, a virtual one on the 3rd Thursday of each month from 5:30 to 6:30, and an in-person version is the first Tuesday of the month from 6 to 7 in Pavilion 2. Thank you so much for watching this presentation. I hope I've helped you in preparing for your upcoming surgery and answered some of your questions. Please feel free to reach out by email or phone if you have any questions that I can help with before your surgery. And I look forward to meeting you soon. Thank you.